Thank you all for being here, because today is a very special day for Jackie, as she starts her first step on her journey as a healthcare professional. It was over a year ago when Jackie received her early acceptance letter into the Stanislaus State Accelerated Bachelor's in Nursing program. I remember we were in San Diego visiting friends when she found out, and it was a special day of celebration, just as today is one of those special celebrations. Throughout the last 18 months, I've been witness to Jackie's transformation into a healthcare provider. Her knowledge and ability to assess health conditions and her skill set to treat patients has grown exponentially. Jackie has always been the type of person who goes out of her way to help others, even if it meant taking a few minutes to listen to her patients. There was one day in particular when Jackie was working in the emergency department as a student nurse. It was a busy shift where all the rooms were filled with patients and there was a shortage in staffing. Jackie was the only student nurse on the shift and was responsible for transferring doctors' orders into the computer system, coordinating admissions, and transporting patients who were admitted to the hospital. During the middle of her shift, there was a code blue, where a patient who had came in with cardiac arrest. The majority of the staff was in the trauma room for performing resuscitation measures, including Jackie, who was responsible for preparing the trauma rooms and performing chest compressions. After about 15 minutes, Jackie stepped out of the trauma room, after switching with someone else to perform CPR, and decided to make her rounds around the ER. There was one patient who caught Jackie's attention. This patient came in for chest pain and had already had an electrocardiogram done to rule out a heart attack. The patient was yelling in agony, stating that he had intense chest pain and that he had a feeling he was going to die soon. Jackie talked to the nurse of this patient. However, the nurse felt that the patient was fine because the patient had recently received sublingual nitroglycerin, morphine, and was currently on oxygen, and did not go into the room to assess her patient. When she went back to the patient and listened to him, he stated he felt different and appeared to have reoccurring feelings of impending doom. So at that moment, she used her judgment and decided to perform an electrocardiogram, which was within her scope of practice. Fortunately, Jackie had been proactive in her learning and recently completed an EKG rhythm interpretation certification course, which was not required for her scope of practice. She noticed that there was an ST segment elevation, which signifies a myocardial infarction or heart attack. She immediately approached one of the doctors on the unit, and the doctor agreed that the patient was currently having a heart attack. Jackie immediately activated a STEMI alert, which indicates a patient is having a heart attack and notifies the catheterization laboratory staff and cardiologist to prepare for surgery. This patient had a large clot removed from one of his coronary arteries and survived the heart attack. Another evening was also particularly memorable. It was after Jackie had just gotten off of a 13-hour clinical shift, and I could tell it had been a long day from the exhaustion in her face. But I could also see a glint in her eyes. She told me about a transformative experience she had that day. After getting to the hospital that morning, she was assigned a patient. The patient was a homeless man who had been found unconscious on the street and arrived by ambulance. He was admitted for alcohol intoxication. After monitoring him for a number of hours and him regaining consciousness, she helped him to the restroom. In most cases, it's completely acceptable for a nurse to leave while a patient is using the restroom and come back in a few minutes to check on them. But Jackie felt that this patient needed a little more attention, so she decided to wait outside the restroom while he went. However, when she heard odd grunting, she asked if he was okay and then decided to check on him when there was no response. When she opened the door, she saw that he was slumped over and not responsive. She then proceeded to check for breathing and a pulse. When she found neither, she immediately yelled for help and activated a code blue call. With the help of another nurse, she was able to haul his limp body onto the gurney, where she proceeded to perform CPR. After several minutes of chest compressions, she was able to revive the man and stabilize his condition. This was the first time her direct actions had saved someone's life, and I could tell it had a profound effect on her. But it also speaks volumes about Jackie's character. While others would see a homeless drunk, she saw a suffering human being. Jackie sees the most marginalized and neglected of our society as worthy of compassion and care. She is the type of person who will work a little bit harder and pay a little more attention to the details, and because of that, she will make a positive difference in the lives of those she cares for. From tears and tiredness to confidence and competency, Jackie has succeeded in every way as a nursing student and caregiver. Anyone who knows Jackie knows that she seldom takes second place in anything she does. Jackie was consistently one of the top students in her cohort and a leader to her fellow nursing students. She was inducted into the Nursing Honor Society and was offered a student nursing job because of her outstanding academic performance and her exemplary hands-on nursing skill. While she is excited to start work as a nurse, her academic journey is far from over. After gaining the necessary clinical experience as a nurse, she plans on applying to nurse anesthesiologist programs and nurse practitioner programs. Jackie, everyone is incredibly proud of you, and I think I speak for everyone when I say congratulations, Nurse Jackie.